Question number 1. Which hormone is secreted by corpus luteum? Correct option is D. Progesterone. Question number 2. How many layers are present in the uterus? Correct option is B. 3 layer. Question number 3. Which layer of uterus is shed during menstruation? Correct option is C. Endometrium. Question number 4. Which organ connect uterus to vagina? Correct option is D. Cervix. Question number 5. Which hormone decreases after menopause? Correct option is C. Estrogen. Question number 6. Which structure protects vaginal opening? Correct option is A. Hymen. Question number 7. Which phase prepares uterus for pregnancy? Correct option is D. Secretory phase. Question number 8. Which phase of menstrual cycle shows maximum estrogen? Correct option is D. Ovulatory phase. Question number 9. Which structure attaches uterus to pelvic wall? Correct option is B. Broad ligament. Question number 10. Which structure prevents entry of pathogen in vagina? Correct option is B. Acidic pH. Question number 11. Which structure is homologous to penis? Correct option is A. Clitoris. Question number 12. Which muscular layer contracts during menstruation? Correct option is B. Myometrium. Question number 13. Which structure secretes mucus for lubrication? Correct option is C. Bartholin's gland. Question number 14. Which hormone is secreted by placenta early pregnancy? Correct option is B. HCG hormones. Question number 15. Menopause occurs due to failure of which organ? Correct option is A. Ovary. Question number 16. Which symptom is common in menopause? Correct option is B. Hot flashes. Question number 17. Which structure degenerates into corpus albicans? Correct option is C. Corpus luteum. Question number 18. Which reaction allows sperm penetration? Correct option is D. Acrosome reaction. Question number 19. Which hormone prepares uterus for implantation? Correct option is D. B. Progesterone. Question number 20. Which structure embeds into endometrium? Correct option is C. Blastocyte. Question number 21. Which hormone causes uterine growth in pregnancy? Correct option is B. Progesterone, estrogen. Question number 22. Which hormone thickens cervical mucus? Correct option is D. Progesterone. Question number 23. Which structure is most estrogen sensitive? Correct option is C. Endometrium. Question number 24. Which follicle is dominant in each cycle? Correct option is C. Graafian follicle. Question number 25. Which uterine layer undergoes cyclic changes? Correct option is B. Endometrium. Question number 26. What is the average length of luteal phase? Correct option is C. 14 days. Question number 27. Which of the following structure first receive sperm? Correct option is A. Cervix. Question number 28. Which structure connects embryo to placenta? Correct option is D. Umbilical cord. Question number 29. Which phase is most fertile for conception? Correct option is C. Ovulatory phase. Question number 30. Which vaccine requires informed consent often? Correct option is D. COVID-19. Question number 31. Which reaction occurs immediately after injection due to fear? Correct option is B. Sinus cough. Question number 32. Who is responsible for vaccine safely at session site? Correct option is D. All team members. Question number 33. Which vaccine eliminates disease globally? Correct option is C. Smallpox. Question number 34. Which vaccine is mandatory for healthcare worker? Correct option is C. Hepatitis B vaccine. Question number 35. Which disease re-emerge due to low coverage? Correct option is D. Measles. Question number 36. Which vaccine is most commonly associated with fever? Correct option is B. DPT vaccine. Question number 37. Immunization is a part of which level of prevention? Correct option is A. Primary level. Question number 38. Which vaccine provides community-wide protection? Correct option is B. OPV vaccine. Question number 39. What is the main purpose of giving a booster dose? Correct option is C. Increased antibody level. Question number 40. What is the minimum temperature required to store vaccine safely? Correct option is C, 2 to 8 degrees centigrade. Question number 41. Where does progesterone exert maximum effect? Correct option is B, endometrium. Question number 42. Where does female orgasm originate anatomically? Correct option is C, clitoris. Question number 43. What is the function of clitoris erectile tissue? Correct option is B, sexual arousal. Question number 44. Which hormone is responsible for amenorrhea in stress? Correct option is A, cortisol. Question number 45. Which ligament maintains intuition of uterus? Correct option is C, wrong ligament. Question number 46. Where is estrogen mainly metabolized? Correct option is A, liver. Question number 47. Which cell secretes estrogen in ovarian follicle? Correct option is B, Tica externa. Question number 48. What is the function of uterine peristalsis? Correct option is B, sperm transport. Question number 49. Where does ovarian cancer most commonly arise? Correct option is C, surface epithelium. Question number 50. Which adverse reaction involves life-threatening allergy? Correct option is D, anaphylaxis. Question number 51. Which condition causes decreased oxygen supply to tissues? Correct option is B, hypoxia. Question number 52. Which disease commonly lead to chronic kidney failure? Correct option is A, diabetes. Question number 53. Which organ failures causes fluid retention and edema? Correct option is A, kidney. Question number 54. Which vital sign change indicates possible internal bleeding? Correct option is D, falling BP. Question number 55. Which condition occurs after prolonged immobility? Correct option is C, deep vein thrombosis. Question number 56. Which hormone maintains pregnancy during early gestation? Correct option is B, progesterone. Question number 57. Which condition is defined as high blood pressure during pregnancy? Correct option is A, preeclampsia. Question number 58. Which nutrient is essential for fetal brain development? Correct option is D, folic acid. Question number 59. Which reflex is assessed in newborn neurological exam? Correct option is A, Moro reflex. Question number 60. Which condition occurs due to iron deficiency in infants? Correct option is C. Anemia. Synthesis. Correct option is A. Protein. Question number 60. Which electrolyte is high in extracellular fluid? Correct option is A. Sodium. Question number 61. Which mineral deficiency causes anemia despite normal iron? Correct option is B. Copper. Question number 62. Which vitamin deficiency causes rickets? Correct option is D. C. Vitamin D. Question number 63. Which hormone prepares body for stress? Correct option is A. Cortisol. Question number 64. Which organ regulates body temperature? Correct option is D. Hypothalamus. Question number 65. Why is iron supplementation avoided in thalassemia? Correct option is B. Iron overload. Question number 66. Which organ synthesize clotting factors? Correct option is A. Liver. Question number 67. Which device measures air movement in lungs? Correct option is C. Spirometer. Question number 68. Which vitamin deficiency causes beriberi? Correct option is B. Vitamin B1. Question number 69. Which mineral deficiency reduce ATP formation? Correct option is D. Magnesium. Question number 70. Which acid-base disorder occurs in diabetic ketoacidosis? Correct option is A. Metabolic acidosis. Question number 71. Which hormone causes uterine contraction? Correct option is B. Oxytocin. Question number 72. Which energy transfer causes heat loss in cold wind? Correct option is B. Convection. Question number 73. Which principle explain sweating cooling the body? Correct option is C. Evaporation. Question number 74. Which law explain air pressure volume relationship in lungs? Correct option is B. Pile's law. Question number 75. Which factor reduce radiation exposure? Correct option is D. All of the above. Question number 76. Which vitamin helps calcium absorption? Correct option is D. Vitamin D. Question number 77. Which electrolyte is essential for enzyme activation? Correct option is B. Magnesium. Question number 78. Which nutrient is primary energy source for brain? Correct option is C. Glucose. Question number 79. Which electrolyte imbalance causes paresthesia? Correct option is a hypocalcemia. Question number 80. Why does anemia causes shortness of breath? Correct option is B. Heart failure.
Question number 81. What is the normal body temperature in Celsius? Correct option is C. 37 degrees centigrade. Question number 82. Hand washing is most effective method to prevent. Correct option is B. Infection. Question number 83. Which pesticide is used during CPR in adults? Correct option is C. Carotid pulse. Question number 84. Which artery is used to measure pulse in infants? Correct option is B. Brachial artery. Question number 86. Which method is most effective for sterilization? Correct option is B. Autoclaving.